What is on your hands? Even if they look pretty clean, chances are there are all kinds of germs and things on them. But would you guess that on your hands there was nicotine, especially if you're not the one who's smoking? A recent study found 95% of the kids, even those who live in smoke-free homes, carry detectable levels of nicotine on their hands. Now, this is the Thirdhand Smoke Resource Center. The most recent study was done by Cincinnati Children's Hospital and San Diego State University. Dr. Melinda Mahabee-Gittens, a professor of pediatrics, explains some of the health effects in a webinar on the site.
We found higher hand nicotine levels in children who presented with chief complaints of cough and congestion compared to children who did not present with those chief complaints. We also found higher hand nicotine levels in children who had past medical histories or diagnoses of asthma or bronchiolitis.
So you're asking, how do the kids get nicotine on their hands? Well, this graphic kind of clarifies it for you. First-hand smoke is inhaled by the smoker. Second-hand is it's exhaled by the smoker or released from the burning end of the cigarette. And third-hand is toxic residue that just sticks on surfaces and dust after the smoke clears.
Smokers need to know that third-hand smoke toxicants can remain in drywall, insulation, and other building materials, and that smoking in another room using a fan or smoking in front of an open window does not prevent third-hand smoke.
One of the other researchers said folks really need to rethink smoking in their cars with or without their kids being in the car with them. 2 Wants to Know has linked you to this study on our web story.